Okay, everybody, we are back on Well Said Podcast. I'm so excited for today's episode. And this is somebody you may recognize. Maybe it's from TikTok, maybe it's from Instagram, maybe it's from a previous episode when the podcast was straight candid. But Dr. Jolene Brighten is here on the episode. I literally have her books right by me, and I'm going to put them in the camera. Hold on. I got to grab this one. This one's big and full of knowledge. They're both full of knowledge, but my favorites. This is Normal and Beyond the Pill. And I'm not a big reader. I'm going to be honest. I'm going to say that up front. I'm not a reader. But when it comes to health and stuff I actually care about, these are your tickets, okay? I'm so excited for this episode. We're going to dive into a ton of things related to coming off birth control, general period information. So sorry, guys, but this is actually going to be helpful for you too, even though you think you might need this information. If you've got a lady at all, you probably want to know these things. And then just like, why low sex drive? How can we help our different estrogen levels or progesterone levels, endocrine disruptors? There's a ton of things we're going to cover. I have 4 call SYD write-ins, so we're going to answer those. If you were one of the lucky ones that I selected, you're going to get your advice actually answered by Jolene and myself. Of course, I'll add color, but I'm not the expert in this area. I'm like, I'll add color. I'll be here to give a little opinion if I can. Without further ado, Dr. Jolene Brighten. Hi, I'm so glad you're here. How you doing?
Hey there. Thanks so much for having me. I'm pretty good. I'm actually like rocking a hoodie today because I told you
you are
under the weather. And then there's something about just being, well, this is actually our like Dr. Brighten Essentials.
Oh, cute.
Balance
I didn't
era
realize.
hoodie.
Oh, I love it.
Yeah, I'm like, we got these and I'm like, I will live in this. This hoodie is like my favorite, but I'm a bit under the weather today. But I feel like there's like, it's one of those things like a hoodie, like, yeah, like a hoodie, that'll fix it. And plus, I feel like we're going to have an intimate, cozy conversation all about hormones.
Yeah, we are. Do you want to give the listeners just a quick brief, like who you are real quick? Because you are amazing and have written books and you live across the country and you are a doctor. I mean, all the things.
Yeah. So yeah, I write books. I talk a lot about hormones. And professionally, I am a board certified naturopathic endocrinologist, which means I am an integrative hormone doctor. I have a degree in nutrition science and also chemistry. So I'm super nerdy like that.
Yeah, you are.
I'm also a certified sex counselor. I have 2 kids. I love to snorkel and I do like long walks on the beach.
Sounds lovely. You've got like the whole list going. Mine is not that long, but I like the last 2 too. I'm like, I love it. Well, I'm excited. And I think what's interesting too is last time we had you on, I was in a completely different spot. So like you met me when I was still on my birth control. I was taking hormonal, oral birth control pill. I think probably, what would that be? 2 years into my relationship with Jordan. So we weren't engaged or anything yet. We did just move in together. I was having still really heavy periods, like lots of blood, really bad anxiety, bad anxiety, and terrible PMS, like horrible. And I wouldn't say that every single one of my issues is solved because that's just unrealistic. But I will say I'm wearing the OURA ring right now. I literally rock the OURA ring every single day. I track my my cycle through natural cycles and the OURA ring. This is not an ad, by the way, literally not an ad, just saying what I do.
But
and
if you want to sponsor her podcast,
come talk to me if you want to be a part of this. Okay. And I literally like love the way I feel. I know that sounds so cheesy. Like there's been a lot of change, but I got off hormonal birth control and I was scared to do it. And I know a ton of people are scared to do it. We talked about this a little bit previously, but I would say like 50% of my write-ins have something to do with birth control or getting off of birth control or like options of birth control. So why don't we just start with, tell me about birth control a little bit. Tell me about like the fact that I felt like I didn't have an option to get on it. And like, how would I even start the process of getting off this thing? Because I did it, but I wouldn't say that I maybe did it the correct way. Cold turkey.
This is a huge, like this 3-parter is like a huge question, right? Because it is partially filled the entire book Beyond the Pill.
Literally,
okay,
it is
so
the
first
book.
thing to know, I know, right? Okay, like read the book. All right, done. No, okay, so first thing to know about hormonal birth control is that if the primary mechanism is to stop ovulation, then how it works is that it floods your system with enough hormones that your brain says, shut it down, ovaries. So it interrupts brain ovarian communication. The ovaries then stop ovulating and they cease to produce progesterone, estrogen. They reduce testosterone production as well. Now, that's not the only way that the pill works. It also can change the lining of your uterus so it becomes thinner. That's why being on the pill or even get an IUD, that can make for easier periods with regard to they're just not as heavy. So that's the primary way that the pill works. When it comes to feeling like you didn't have an option, I think we should talk about that because
I do too.
I think a lot of people feel that way. They go to the doctor. They say, I've got period problems. I have PMS. I have, headaches. I have, quote, lady part problems. And their doctor says, well, do you want a baby? No, I don't want a baby. Great. Here's the pill.
Yep.
See you later. Everything's fixed. You're fine. Oh, your periods were missing. I will regulate your cycle. You will regulate my cycle with a medication that shuts down my cycle. Like what?
Backwards.
Because so here's the thing. You ovulate, then you menstruate. A menstrual cycle is a complete cycle. A period only follows ovulation. To regulate the cycle, we have to address what is happening around ovulation. If the pill stops you from ovulating, it didn't fix that. It didn't regulate that. And what it gave you was a withdrawal bleed. Oh. And sometimes, like in the case of endometrial hyperplasia, when the endometrial lining builds, we do need to do that because you could end up with endometrial cancer if that went on too long. So there's a time and a place for that. But I think the real problem and the real rub, people are always like, oh, why do you hate birth control? And I'm like, I don't. I hate doctors acting like it's the only freaking option. And then when you have side effects, acting like it's a you problem and not a pill problem.
Right. God, it feels so frequent that I hear people that are like, well, I had a bunch of like problems and I got on the pill. What's going to happen when I get off the pill? Like, it's almost like now you're stuck. And I even felt that too. And I felt like I didn't have an option. I came in with heavy cramps, like sickening, like where I would throw up, like horrible, horrible cramps. Like, I mean, very heavy bleeding problems too. And I was worried that if I got off the pill, all of that was going to come back. What I didn't take into account, just as a side story, is like, my life looked a lot different. My stressors were a lot less. I had a really, really well-balanced diet. I was taking my multivitamins and a variety of greens, like vegetables and stuff that I probably wasn't getting in back then. My life looked completely different. And I had spent the time and work to get my hormones a little bit more regulated through nutrition, right? So I don't know. I think I shouldn't say nobody, but most people don't have the tools or the knowledge to be like, okay, yeah, and I can get off if I want to get off. A lot of people are just afraid of the unknown. So what would you say to somebody who is like, I'm ready to get off. I know that's the best option for me. Like how do I go about doing this?
Yeah. So as I explained in Beyond the Pill, if you start it for symptom management, you need to give yourself at least 3 months. This is what I've seen clinically of supporting your body and preparing to make that transition off. If you're on the pill, it is depleting nutrients. We know there's lots of medications out there that deplete nutrients. If you are on metformin, your doctor's probably going to talk to you about B12. If you're taking a statin, your doctor will probably talk to you about CoQ10. If you're taking birth control pills and you ask about it, your doctor's probably going to tell you, just eat a regular diet. Just eat a standard diet. Oh, the standard diet? The standard American diet? You mean the most nutrient devoid diet that exists? That's going to replenish my nutrients? Yep. This makes no sense. So we want to replenish those nutrient stores. So that's one thing you touched on. Absolutely. Even if you didn't have symptoms, if you're on the pill, you want to stay on the pill, then make sure you're taking a good multivitamin prenatal. It's your little insurance policy, and look at your diet. And definitely support your diet. Now, in Beyond the Pill, I take you through all of the steps, like looking at what the pill has done with metabolic health, how metabolic health is so important, evaluating your own hormones and identifying what was your hormone imbalance, like what was the problem that got you on the pill. Let's start addressing that now. If it was painful periods, let's start getting your omega-3 fatty acids up and your magnesium up. So let's eat more cold water fish. And if you're vegan, let's supplement with algae. In fact, we all would do well to supplement with omega-3 fatty acids. I actually had the opportunity to just speak with a brain researcher in women's health this week. And she was like, oh yeah, omega-3, take your omega-3s, take them. I think it's so funny because you'll hear doctors out there being like, no, there's not enough evidence. But I will tell you, there's such a disconnect between research and like what is being done in clinical practice, because doctors are like, don't take your multivitamin, don't take your omegas, like supplements do nothing. And then you talk to researchers that are like specialized in these fields and they're like, take it.
You're like, what are you doing?
And you want to make sure this stuff is like clean, right? And when I say clean, because like, what the heck does clean mean? People are like, I eat clean. I'm always like, tell me more, say more. I don't understand this. What does that mean? So when I'm talking about like that they're screening for heavy metals, that there's third-party testing going on, that they're not cutting the fish oil with canola oil, cough if you go to a big box store. If your fish oil, if you're like, man, this is such a deal. Like I scored. This is such a good price. No, it's not.
No.
You get exactly what you pay for supplements. And trust me, as somebody who has worked in nutrition for over 2 decades and has a supplement company, I'm like, whenever I see someone selling certain supplements, like on Amazon, I see the price point, I'm like, I know for a fact you cannot get those raw ingredients for that cost. You could not do that. You couldn't make that and sell it even at that price. You absolutely could not do that. So we've been talking about nutrient stores, metabolic health. We want to look at our hormone imbalance, like what can be going on with that. We've got to address things like inflammation. And so much of this comes to what you were saying about like your stress, your lifestyle, what's going on with your diet is absolutely crucial. But being very targeted in what the approach needs to be for you. So like I said, we've got those painful periods. We want to increase the omega-3s, we want to increase magnesium because the painful periods are likely from prostaglandins, hormone-like chemicals that are made from omegas. Eat too much omega-6, standard American diet that your doctor's like, just eat a regular diet, like no big deal. Yeah, you're going to have painful periods because those omega-6 makes for really potent prostaglandins. But if we can eat more omega-3s, then it's less likely. When I came off the pill, and I talk about this in the book,
I was going to ask you about
developed
this.
a whole... What's that?
I was going to ask you about this actually, about your experience, because I remember you talking about it.
Totally. The fact that like I struggled with yeast infections for as long as I did, and doctors being like, oh no, this is like, you just need Monistat, until like my vagina turned inside out. Literally your vagina is the inside, vulva's the outside. Mine decided to hang out with the vulva for the day. This sucked because I was in college and I was a spin instructor, and I also rode my bike to school. Now imagine this, you have an allergic reaction. You're having a yeast infection. You already have inflammation. There's discharge. You feel awful when you have a yeast infection. Like if anybody's ever had that, you know. And then you insert Monistat and you're like, oh, like that's going to give me relief. Like praise Monistat. And then you have an allergic reaction. And now you are like having to teach a spinning class and you're like, something is wrong. Something is wrong here. And then like, you know, I have to ride my bike to campus and I'm like sweaty and like all of this stuff. And I finally like get home and I look in the mirror and I'm like, oh my God. And I call my doctor and he's like, you have allergic reaction to Monistat. Like, yeah, you can't use that. And that's when he turned me on to boric acid. That was like, you guys, this is like 2 decades ago when that went viral on TikTok. I'm like, I've been using this in my pain. Let me tell you, I will testify. But did I have a boric acid issue? No, I had a birth control issue. And that was causing all, like, man, I just want to say, if you know, you know. But people who act like yeast infections are like, oh yeah, you just have a yeast infection. You haven't had one because it is so much inflammation. It is so painful. It's so distracting. Like I remember just like not being able to sleep at night. Anyhow, that's my vagina woes. But when I came off the pill, I was put on it like heavy painful periods. And I also didn't want to get pregnant. And thankfully, I'm a doctor now because I didn't get pregnant. And I was able, and to people who do get pregnant and still become doctors, you are amazing. I don't know. Oh no.
Praise the Lord. I don't know how to do it.
I have 2 kids now and I'm like, oh no, that's like, you are a special person. But when I came off, I developed symptoms I had never had before. So yes, the painful heavy periods came back and it was hell. And it was like 14-year-old PTSD of like bleeding through your clothes. And like, thank God, like back in the day, we wore hoodies around our waistline. Like that was a look. Like, oh, you got a flannel shirt around your waistline, like the grunge era. Like, yes, I'm old like that. Yay, because like it was really like period pants smuggling that was going on there. So with that, I also developed cystic acne. And like everybody looking at my skin now, my skin is clear. Like,
You're glowing.
acne has never been my issue. Thank goodness. I don't know. Maybe I would have traded that for all the like yeast infections, but I didn't have skin issues. And I came off and I developed cystic acne. And it was so bad. Now, what happened initially is that my period went missing for 3 months. So I had always had periods. I counted them down like the doomsday they were, because when you bleed for like 7 days and feel like you're going to die, like you count it down. You're like, I know when this is going to stare me down. And with that, like my doctor, man, like one of the OGs, this was a new doctor, not the boric acid saved my vagina doctor, but new doctor. And he was like, periods missing and you have cystic acne, you have PCOS. And I was like, no, I don't, because I know PCOS, you have irregular cycles. I never have. And no one in my family has any fertility issues, any acne, any of the stuff that would be PCOS. My family does not have that. No one around me has that. I came off the pill. This is what happened. And so I had to really like hack. This is why I'm always like, women are the original biohackers, because God, like medicine has left us to ourselves so often. And I figured out like and got my period back. And then when it came back, it was like, scene straight out of Carrie. I was like sitting in class and I just remember like all like feeling it, just being like,
you're like, oh no.
My God, I think my period's back. And then, horrifically painful, and, I was able to clear my skin. And I want to say that the haters out there that were like, which are mostly like, there's really awesome gynecologists, but they're hater gynecologists. And they're like, and if you're listening, you've probably met one in person. In real life, you've been in their office in stirrups and been like,
like, I'm scared.
They were like, oh yeah, if she had cystic acne, like, why does she not like have proof of it? I'm like, well, because when this was going on, the iPhone had just come out and we weren't taking photos of ourselves like this. So we'll fast forward to like me going through fertility treatments, and I had to be on the pill. This was last year for 10 days, cystic acne.
No, stop.
And you better believe I caught photos of it then. And I was like, check it. Here it is. Like this is like what it does to me. And part of that, of healing that, cystic acne is another component of coming off the pill, which is taking care of your gut, making sure that you support your liver. And the pill can disrupt the microbiome. And anytime we see skin issues, we always ask like liver, gut, what is happening there? What's happening with your ability to detox, to process your hormones? And probiotics, yes, but also looking at like getting your fiber dialed in, making sure that like you're getting your prebiotics coming in, making sure like I'm like up in turmeric, ginger tea, like anti-inflammatories to the gut, taking out glutamine, like, doing all of these things. And then also here's the not so fun part. Yeah. Not drinking wine, no alcohol, because that's not great for your gut. Yeah. So, it's not always like what you put in. It's also, there has to be some takeout in, not tasty takeout, but the kind of like you gotta take out some stuff. Like alcohol is a big one.
It's such a bummer, but it also, I don't feel good on alcohol. So I'm like, you know what? This is a good sign for me, because I've noticed such even coming off the pill too, like I felt like, I was worried horrifically that I was going to get acne. And I was like, what if I get off the pill and acne just comes about? And I would say it was the opposite. I think my skin did have a little bit of a purge like situation going on for a second, but my skin is very clear right now. Why is it that people are so afraid that they're going to get acne like when they come off the pill? Because I feel like that is the number one right. And they're like, how do I go off the pill and not get acne? Like, what am I doing?
I just love that for you though. I just want to say, because there are women whose skin does get worse on the pill, and they're like, I've had patients that like, they end up getting acne on like their back, on their chest, on their butt while they're on the pill. And then they'll come off and things start to clear and it looks so much better. And I'm like, I love that. I wish that was my experience, but I get clear skin all the time. I'm really like,
you're lucky.
I love that. I would love to be like, oh, I'm just blessed like that. But I do a lot of things to take care of my skin.
You do.
So the fear is real around acne. If you had acne before going on the pill, I mean, that's one of the big reasons it gets used, and it's because it suppresses androgens. So when we think acne, the most common kind of acne is hormonal based. There can be fungal acne. There can be different things going on, but the most common that we see is hormone based. little like tool right here. Again, omega-3 fatty acids. There's actually research that shows that people who have higher levels of IGF-1. So IGF-1 is a hormone. It's insulin like growth factor. It can drive acne. And people who have higher amounts of omega-3 fatty acids, they have lower levels of IGF-1 and they tend to have better skin. So again, this is why I take my fish oil every day. So the threat being real is that when you come off the pill, even if you didn't have acne before, there's something called an androgen rebound. And that is where, after the ovaries being suppressed, they get really excited to be like, we can make testosterone again. Yeah. And in some people, because the cycle can take, like, it doesn't just like instantly come back. There are people who like ovulate like within a few days of like coming off the pill. Their body's like, I am ready to go. Let's do this. But that's not most people. Most people, it's going to take a little time to establish that rhythm again of brain-ovarian communication and bring that estrogen and progesterone up to challenge testosterone. Now, if testosterone rebounds, it shoots up and it comes out to play, and there is no other hormone to be like, slow your roll, it can cause oily skin. So increased sebum production. We get more oil. We can see that there is more cells being produced. The microbiome of the skin, so bacteria can get trapped as pores get clogged. Now we get those red, sometimes even whitehead pustules going on. And really, at the crux of that, hormonally speaking, is we've got to be addressing the testosterone. So that's where I talk about things like zinc. Yep. In some cases, we use herbs like saw palmetto. If it is a case where I ask somebody, what were your cycles like before you get on the pill? And they're like, they were completely irregular. I had acne. My doctor said, hey, get on this. I'll regulate your cycle and you'll have clear skin too. That's where I'm like, let's get some myo-inositol, D-chiro-inositol going, a little bit of spearmint mixed in there. Like, let's get some things, because this is probably going to be a PCOS case when I can actually test your hormones and get accurate information. So it is right. If you are afraid of acne, that's where I'm like, do the Beyond the Pill protocol for 3 months. That is something that was developed with my patients. When I wrote the protocols in that book, I wrote that book so incredibly fast. And people are like, how were you able to write a manuscript that fast? I mean, I just went into my chart notes and I just started pulling out like, this is what worked. This is what worked. And like plugging it in. It was written. It just was in medical format. And I just had to like transition that to the layperson. So that protocol can really help in there. And again, like liver detoxification, people are like, oh yeah, you don't need to detox because your liver does that. Yes, and you have to support your liver. You have to give those nutrients that the pill's depleting to your liver so it can do its job. You also have to have amino acids coming in. And sometimes, depending on like how we're processing our estrogen and how things look for the individual, we need to be ramping up cruciferous vegetables and broccoli sprouts and bringing in very specific foods to support liver detoxification. It's like being like, oh yeah, your hair just grows, your nails just grow, but we know you require protein for that. And I will also say to people, like as somebody who has a degree in nutrition science, who's been in the field for 2 decades, I am always very cautious to take any information from somebody who didn't actually get trained in nutrition or took a weekend course and now decided that, because they're like, they have medical credentials, therefore this weekend course translates to them being like a nutrition expert, and they're not. And I just want to praise doctors out there who didn't get it the first round, but then later went and did extensive training to actually understand nutrition, because if what you eat is integrated, it's assimilated in your body, it becomes every single cell of your body, then how in the heck can that not be one of the primary things that we look at when it comes to health?
Nutrition 101, like literally nutrition, what you're putting in your body, what you're doing for your body, how you're moving your body, all the things matter. It's not just this singular thing that can cause all of these things. That's what I think you're like preaching all the time too on social media, is like, yes, this little pill, it's kind of scary. You're going to get rid of it. But I promise you will be okay. And there's so much more to your health than just this little pill that might cause a little bit of acne. You know what I'm saying?
You deserve more and you deserve better. It's something that if you want to use the pill, perfectly fine. But you deserve holistic healthcare, like an approach that considers all of you and also considers the side effects that can come up. And if we actually just acknowledge the side effects as being real. And that is what I have set out to do since I ever took to social media, is validate that these side effects are real and that there are things you can do for it. Like for me, if a patient wants to go on the pill, I'm going to do everything we can to help. I'm going to take their full history and try to predict what might come down the pipeline with that, and then teach them and guide them how they can prevent those symptoms, but also what to look out for. Because there are conditions like endometriosis, for example, that somebody's like, I can't afford an excision surgery. I need to stop having a period altogether because I can't function. I'm vomiting like 10 days. In some instances, it can be that bad. Or I can't even get out of bed. Like whenever I hear people in the wellness arena being like, oh, nobody needs the pill, you just need to eat right and exercise. And I'm like, except that doing those things requires energy and your ability to function. And sometimes you have a condition that has gone on for so long and it is so severe that we have to use that medication. We should always acknowledge when we're using a medication for symptom management and have a plan to get a patient off of it if possible. Every medication out there, we always want to consider, is this lifelong or is this something that it can help the patient come off in the future? Something like thyroid hormone replacement therapy because you have autoimmune destruction of your thyroid, you're going to be on that for life. We can't regrow your thyroid at this point. There's speculation we might be able to, and it might be able to heal, but there's just like nothing out there that really do that. And not going without thyroid hormone can result in cardiovascular and brain damage. Like we don't want to see that happen to you. So understand that if you are someone who's like completely anti-pill, that is great for you. I will always support you, but I also will always support women having access to this when they need it, and then having the tools they need to mitigate those side effects, or maybe transition off when it's time.
You have it's like all the knowledge of what I think everybody's they want their doctor to be. I'm like saying that all broken up, but it's like, I want every doctor to be like you. I want every doctor to give me the options. Here are options. This is what I would suggest. This is what I would suggest based on this information. Like, I feel like it's like you've got the whole holistic knowledge. It just stinks that a lot of the doctors that we go to don't have that. And that might not be their fault. It's just like what they've learned, what they've known, what they've studied. And it makes it so hard for us to differentiate and be like, oh no, Mrs. Doctor or Doctor, you're wrong. And I actually have a different idea of how I'm going to do it. It just makes it hard to source information. So the book.
It does. And to be fair, if your doctor's stuck, so a lot of people don't realize that a lot of groups are buying up medical practices now.
Oh.
And so it's not getting better because doctors are being forced to see 30, 35, sometimes even 40 patients a day.
Oh my Lord.
In an insurance model, and they don't have a choice, and they can't, there is no time for you. It's not your doctor's choice. It's not what your doctor went to medical school for. They went to medical school because they really wanted to help you, but they end up in these systems that don't give them the space for that. And they're basically like, you've got 5, maybe 7, maybe 10 minutes, get in and get out with that patient because we're not going to leave you any breathing room in your schedule. And so it's really unfortunate because I think it's really easy to hate on doctors. And like, look, just like there's, the mechanic that you would hate on, the plumber that you would hate on, like they did a bad job. I don't like them. They don't even care about their job. Those people exist in healthcare as well. Yep. Every single profession has people that really, they should get a new career. Like they should do something else there.
That exists.
But a lot, like when you look at becoming a doctor, I really feel for providers who are like, I'm stuck in this system and I want to do better, but I can't do better. Who I do not feel for are the doctors out there that, I don't know if you saw when like IUDs and talking about pain with IUDs insertion was going around, and how many gynecologists came out to be like, yeah, well, there's no good way to administer pain and the cervix doesn't feel anything. And I'm like, that is such a lie. It is such a lie. Like, it is a lie. It is not based on evidence. But also, you're telling us right now you're not listening to your patients. Other countries are like doing pain management with this. And if you're a man who gets a vasectomy, you're going to get like heavy hitting pain meds before you even go in to have a much simpler procedure done than what can sometimes happen with an IUD insertion when they're like dipstick in your uterus trying to be like, what's the length of your uterus? Oh, I got to clamp your cervix. So I got to move this. I got to like, and it's like, that in some ways, like as I don't do vasectomies, but as having witnessed vasectomies and then having done IUDs and had an IUD myself and watched IUDs, I'm just like, really? Like, we're not giving pain meds for this? But
that's horrible.
Man, when I got an IUD, I don't think I've ever cursed more in my life.
Oh my God. I've heard it's horrible.
Yeah,
I've heard it's the worst experience ever. And I mean, actually, I want to talk about this because I'm talking about other ways to have birth control methods, like maybe non-hormonal ways to have birth control methods, because a lot of people were like, well, what about the IUD? Of course, there's a copper IUD, right? There's different options. A lot of people wrote in asking, like, can I trust the OURA ring? Can I trust natural cycles? Like this almost like distrust in other options. I would love your opinion on that.
No, you can't just trust an app with your fertility. No, you can't just trust anything to your fertility, except maybe like the IUD. But even that has a 0.1% failure rate and it can fail. But, it's this idea that we've been sold that the only way to 100% manage your fertility is with a medical intervention. Now, IUDs, 99.9% effective. Like you're not going to beat that. You're not going to beat it. Like, except maybe vasectomy and that done right, and making sure there's no sperm count after that, right. Or even, tubal ligation, but you're not going to beat an IUD. So if you're talking about like what contraceptive methods do we have available, even the pill has a failure rate.
Yep.
And when fertility awareness method is done right, it does rival the pill in terms of its efficacy. But just like the pill is not for everyone, fertility awareness method is not for everyone. So as we talk about OURA ring and we talk about natural cycles, that is a piece of fertility awareness method. And this is so important for people to understand, because sometimes I hear from people, well, here's the biggest thing I'll hear, people who are like, I had a friend of a friend of a friend that's cousin got pregnant using fertility awareness method. It always seems to be like this chain of people. And then you got doctors out there that are like, oh, fertility. They don't even say fertility awareness method because they don't read the research. They're just like, someone said to me, like my attending who was trained like in the 60s says rhythm method. So it's all the same, right? And they're like, we call the rhythm method? See you when you're pregnant. And I'm like, oh my gosh. Okay,
Lord, help me.
Here's the thing. I've had so many patients who have told stories to me of getting pregnant on the pill. I know lots. And it is common because that has a margin for user error.
Right.
Fertility awareness method has a margin for user error. But what I often hear, and this is the most common one, I say, okay, well, tell me, what method were you using? What were you doing when it was your fertile window? Oh, we just went ahead and pulled out. No, friend, that is not fertility awareness method. You have now entered into pull-out method, which 1 in 5 are going to get pregnant. It's like, come on, 20% failure rate? Man, no. And look, if you're okay gambling with the idea that like, I might get pregnant, that's not the end of the world. I'm not ready, but like, then fine. But that's not fertility awareness method. And fertility awareness method is not also just tracking your temperature data.
Right.
That is one piece and so important, but you need to track your fertile cervical mucus. You need to see like what's going on with your libido. You need to look at other signs. So it's called the symptothermal method, and it's where you couple symptoms with temperature, and that is knowing your body. Now, if you are somebody who has PCOS, you're in perimenopause, and your cycles are becoming irregular because they're about to skip out on you, no, you still might get pregnant. So be cautious there. If you are a night shift worker, if you have hypothyroidism or another chronic disease, this method might not be best for you. It might still work for you, but what I would encourage is that you meet with a fertility awareness method trainer, somebody who actually has training in this and can counsel you in this. So they're called educators, not trainers, but I do feel like you have to be trained in it. It's not just educated. You also have to just be trained in how to use this method. So it is a method that if you do it right, you can trust. But the premise is this: you have a fertile window. People will say like, oh, women are fertile 6 days out of the month because you have a fertile window. No, you are fertile 1 day out of the month, but those sperm, they're going to stick around.
They're going to hang out.
Your uterus is going to keep them alive, but I still like to think of them as loiterers. But they'll stick around for like 5 days. And so it's called a fertile window, but it's not that you're actually fertile. And this is where the language really matters, because when you're trying to get pregnant, understand that you can have sex during that window, but we have to catch ovulation. We have to catch sperm being around the day the egg comes out, because you've only got 24 hours before that egg is done and gone.
Wow.
And then just so people know, since we're talking about this, let's bridge this into your menstrual cycle. So after you ovulate, what's left behind is a corpus luteum. It's a temporary endocrine structure that produces progesterone. Now, the brain is going to pulse luteinizing hormone, and that's going to tell that progesterone production to keep going. That needs to make it at least 10 days if you have any chance of getting pregnant. So if you are somebody whose cycle, and this is really what, one of the things that cycle tracking shines at, you know your cycle so well. If your period is coming sooner than 10 days after you ovulate, you've got an issue with your corpus luteum. You are not making enough progesterone, and you likely have awful PMS symptoms. Now, fertilization happens in the fallopian tubes. It doesn't happen in the uterus. So the sperm have to make their way there. Fertilization happens. Little ball of cells divides, and makes its way down to the uterus. And that takes time. Usually, the earliest you're going to be able to get a positive pregnancy test is 8 days, but usually not even 10 until after ovulation, because that little ball of cells has to travel all this distance, and then the embryo has to implant in the uterus. And at that point, once that happens, it makes beta HCG. That's what everybody knows is the pregnancy hormone.
That's what you're testing
beta
it for.
HCG is what keeps the corpus luteum going. If there's never implantation, then there is no way the corpus luteum can survive. It cannot keep going, and your progesterone drops and you get your period.
Wow. I'm like, it makes so much more sense when it's laid out like that. Also, the systems of what you talked about of this little thing is not going to save you from getting pregnant if you're not paying attention. That's what I'm taking away from that. It is I need to be paying attention to all the symptoms of my body. My temperature, yes, but also like you talked about discharge, the scary word, the discharge word. There are things in the OURA Ring app and in the Natural Cycles app. I've read them and I look at them. You have to be paying attention. If you care enough to get off the pill, care enough because you want to make a change, and do something different and not get pregnant, you need to pay attention. That's just inevitable. So I appreciate you talking about that. I feel like I have so many questions. I'm like, oh my gosh, I need to organize how I'm going to ask you all these, because we talked about
the other thing I want to say is that if you are someone who thinks you want to be pregnant in the future, tracking this data now is so helpful. So I personally, not to influence anybody, because I've been on the pill, I've had an IUD. And then after my son was born, I decided to go the route of fertility awareness method after so many patients proved to me its efficacy. And I didn't get pregnant for 8.5 years until I chose to. And then the month I chose to get pregnant, I got pregnant the first time.
Holy Jesus.
Because I had it, and at 40, right? And I had it so dialed in.
Wow, that's impressive.
And so that's another thing I'll just sing the praise of Natural Cycles, is that I have so many patients who share that data with me. And I'm like, this is so helpful.
I know.
To see what's been going on with your cycles and to understand this.
And it asks the right questions too. So you have the options if you want to go a route of non-hormonal way. There are options for you. I want to ask this question, just one more question about birth control, because I want to get to PCOS. I want to get to endocrine disruptors. People writing in asking about, I've been on the pill there were people that wrote in that were 20 years. I think I was around the 15-year mark. I'm pretty sure. Maybe I'm exaggerating that number just a hair. What did I do to my body is the question. They're like, am I going to get pregnant? Am I going to be able to do that? Am I going to have an early menopause? That's the other worry. What did I do?
Okay, so you probably won't have an early menopause. What did you do? Welcome to a great question that exists within the biggest uncontrolled human experiment of our lives.
It's horrible. It's horrible.
And actually, Dr. Elizabeth Kissling, I hope I'm not butchering her name. She actually said this in Scientific America, is that the birth control is the biggest uncontrolled medication trial, basically. I'm paraphrasing. It's not exactly what she said, but we don't know. This pill was designed to be taken for a couple of years when you're in your reproductive window to space pregnancies and delay pregnancy. And yet it's being used for all kinds of symptom management. And we have no idea what happens when you're on it for 30 years. We have speculation. We've got a lot of people saying absence of evidence is evidence that it's fine. That's not true. That's not how anything works. And we also don't know. The big question is, you got a 14-year-old, she has 2 periods in her life, you put her on the pill, and then she comes off of it at 44. What did we do when we know these hormones are necessary for brain development, for bone mineralization, for so many things? These things called, sex hormones, as it turns out, are much more than just baby-making hormones.
Yeah, they go to other parts of your body.
Much more.
Yeah.
Absolutely. You have receptors everywhere for these. So we don't know. Does that mean you should get scared and freak out? Look, what's done is done, and getting scared and freak out, that's not good for your hormones. So don't panic, okay? But I can't give you an honest answer because the research isn't there. And this is something researchers are actually frustrated in, and nobody wants to fund this study to follow women for like 30 years. Oh, by the way, I might not be around on this planet by the time that study got published. So we can't wait around for these studies. We need to start just looking at how can we support the person who's on it now. Now, to the question of can I get pregnant? Question mark. Because how old are you?
Right.
And what's your family history like? And do you have any autoimmune diseases? And have you been a smoker? And have you been exposed to environmental toxins? There's so many things that come into play. And so often when women come off the pill and they find that they're unable to conceive, there's 3 big scenarios that I see. So number 1 is they had a condition, PCOS, that is associated with infertility. It's one of the causes of infertility, one of the major causes of infertility. But they had acne. Their doctor just put them on the pill. Or their cycles were kind of dodgy. They never knew it was going to show up, and their doctor put them on the pill. And in that, they were allowed to just go through their life with a complex endocrine hormone and metabolic insulin resistance, inflammation, cardiovascular disease developing condition going on, and it was never addressed. And when they come off later in life, they find, I actually have PCOS, and I have to address that if I'm going to be able to get pregnant.
Right.
Other scenario, they were put on it because they had heavy, painful periods. Period pain that was robbing them of their life. Their activities of daily living were hindered. And so, can you blame them for trying to get relief in any way they can? But then they come off a couple decades later to find out that the endometriosis that was never worked up was allowed to proliferate and grow, and that because of those lesions, the increased inflammation and immune system activity, they can't actually get pregnant. Now, the third scenario is, those 2 conditions are the top conditions. When you look at the symptoms of why the pill is prescribed, those symptoms fall nicely into those 2 conditions. Now, it can be other things, but that is why there's a big reason we've got a big delay. So PCOS, you're going to have to go to 2 to 3 doctors on average before somebody does something other than the pill to get you a diagnosis. Endometriosis, you're probably going to wander the planet for 10 years or more in pain, feeling awful, being past NSAIDs and the pill before anyone works you up and figures out that lo and behold, you actually have this systemic, and both of these are systemic issues. It's not just a baby container issue. It is the entire body issue. Okay, so third scenario, you, like a lot of people, wanted to have a career, go to school, or just find Mr. Right and space, or Mrs. Right, and space that pregnancy. Yep. And so to have time to where you're not having to worry about, you're just I'd like to buy a house. I got things on the list that got to be checked off before I had this baby. So a lot of people do that. Look, I didn't have my first kid until 31. I went to medical school. I'm with you. Let's check some boxes before we have kids. And yet there are women who will delay until 38, 39, thinking, well, my doctor told me when they prescribed this, I could just come off and get pregnant right away. But the reality is that your fertility is declining. Even if you're on the pill, you're not saving any eggs. They are going away. And as you age, not only are your egg stores going down, but their quality is also diminishing. Nutrients like CoQ10, which is also depleted by the pill, by the way, This is so, so important for mitochondrial health and egg quality and our own CoQ10 in our body. That is going down as we age. Wow. And so this is a situation where women are like, wait, I came off. And in some instances, depending on the contraceptive, they come off at 38 and they're like, I'm not going to get the next Depo-Provera shot. Well, it's well acknowledged that it can be 18 months before you ovulate again. Now you're not going to ovulate again until you're like 40. That's associated with lower chance of becoming pregnant, higher miscarriage rate, also, chromosomal abnormalities with the baby, and higher risk. You're at higher risk of being pregnant in your 40s. And so it's important that we have this conversation. And I tell patients, look, if you know you want to have a baby, let's get you off of this at least 2 years in advance so we can understand your cycle. If something comes up and there's a problem, let's work on that, right? And not work on it when there's like this deadline and this pressure of like, because when you want a baby, when you're ready for a baby, you want the baby yesterday. Yeah. This is always what happens. You're like, I was like, I'm never going to have kids. I don't want kids. Tra-la-la, going through my life. And then I'm like, I want a baby. And then I'm like, I want a baby now. Like, what is happening? And that happens to so many women. Like when they decide to get pregnant, they're just like, I'm ready. Let's do it. And then they're like, wait, why am I not getting pregnant? Like what's going on? And so rather than having that pressure, getting off 2 years in advance, really working on your body, building up your nutrient stores. We don't want to enter pregnancy nutrient depleted. No. And looking at what's going on. If you've got bad PMS, you're probably going to have a rough time postpartum because there's things underlying those hormone issues. And so we want to work on all of that because it's not just about getting pregnant and staying pregnant. It's about having the healthiest pregnancy, you thriving, you not ending up like, with hypertension or, preeclampsia, and having the healthiest baby and then having the best experience postpartum. Like there's a long game here. And it's not just like, conception to delivery. Like then you're going to be in it as a mom. And so we want to do everything we can to give you your best foot forward because we know when mom is at her best health, physically and mentally, babies, children all together, the outcomes are so much better.
Oh my God. Yeah. Wow. Geez. Every time I listen to you, I'm like mesmerized because I'm like, oh my God, all this information I didn't know and all these connecting the dots of like, this does this and this, we need this to happen. And it's like, oh my God, you feel silly and you can't help it that like I've gone through life not knowing this information, almost setting myself up for failure, not on purpose, but just not knowing and like just choosing the thing that I was like, I guess this smart person is telling me to do this. I'll do it. You know what I mean? So props to you for all of that. Like,
thank you. And I just want to bring this up because I want to validate what you're saying.
Yeah.
I had a patient this week saying, as I explained some of this stuff to her, and she was like, oh, well, and I was mad at her doctors for like not telling her things that they should have really said. And she's like, well, this is my fault because I should have known. And I'm like, how would you know? How would you know? Sex ed didn't teach you. Your teachers didn't teach you. Your teachers didn't teach your parents. Like your parents didn't teach you everything. How could they know all of these things? And your doctor didn't tell you. As women, we have to stop being like, I'm silly. I'm stupid for not knowing this. Like even though the internet exists and there's a plethora of information, you have to know exactly what to search for. I mean, part of being a doctor is knowing the picture, the puzzle pieces that come together and knowing like how to dig deeper and how to go after that information. You have to go to medical school to understand how to do that. And so I want to validate that like it is a very common experience to be like, I'm so silly. Like, why didn't I know this? And also it's not your fault. Somebody should have taught you. And honestly, we should be asking, why is sex ed not better in the United States?
I appreciate you saying that because that is very helpful to know. You don't have to feel dumb. You don't have to feel stupid. You just have to, even your energy and urgency towards trying to figure it out now is a big deal. So like props to everybody who's even listening to this and like searching for the next step. There's so many things I want to hit on. I'm going to have you back. That's already, we're going to have to do that. You're going to have
round two
/ round 3.
Questions too.
I know. And I'm like, oh my goodness.
Everybody saying there's questions.
I know. They're like, oh my God. Well, luckily I built some into the actual questions I'm asking. Let's be fast on a few of these. Improvement in PMS. How can we support improvement of PMS? Can we even do that fast? I know. I'm like, we can be fast, right?
Okay. Improvement in PMS. Okay. So I'm going to just say, read Is This Normal? Do all of the nutrition and lifestyle there.
Yes.
But if you're struggling with PMS, then you're probably struggling with low progesterone. If you're struggling with low progesterone, then you likely have symptoms of elevated estrogen. Your estrogen just feels too high. So we want to support estrogen clearance, doing things like eating our broccoli, getting our broccoli sprouts, making sure that we have at least 25 grams of fiber coming in every day. And then we want to look at nutrients like vitamin C, B6, calcium, magnesium, and Vitex, which is also known as chase tree berry.
Yeah.
Fast. I did it.
Fast as ever. Well, and it's your body telling you that something's missing or something's wrong, right? And I didn't have the knowledge or the understanding of like, oh my God, I don't have D3 and I feel like anxious or I feel crazy. Like, you know what I mean? Like it's just knowing that nutrients is a lot more than just having like a salad for lunch, you know, and like that your body's trying to talk to you if you're having freakouts. That's like really what I had to come to terms with. Okay. You talked about natural way to get progesterone. What about estrogen and just like low estrogen? Because that can cause, of course, I did the checklist too in your book. It was in the Is This Normal? And it was about, you know, low estrogen. And I was like, oh my God, I do kind of sometimes have low sex drive and all of these things that I was like, oh my God, I think I'm low. Turns out, got my blood work back. There is a little bit of I'm on the lower end of estrogen. So like, what would you say for someone like me who wants to up that?
Okay, so if you have low levels of estrogen and you are not nearing menopause, so you're not like 45 or older, that's where we start to think about what does your stress look like? So over exercising, under eating, these are two major stressors that will lead to low estrogen. Vitamin E can also be helpful with low estrogen. Vitex is something that can work for both progesterone and estrogen and really help like in harmonizing those. And then we also want to look at like what's happening with the estrobolome. So what's happening with your gut health as well, because that can be another piece. But if estrogen is starting to go low and cycles are becoming irregular and you are under 45, we want to investigate things like hypothyroidism. We want to look at primary ovarian insufficiency. In rare cases, something called Addison's disease, you'd have 21 hydroxylase antibodies. We look for that. That can also be a cause of the ovaries starting to fail. And so we do always want to dig and understand what could be the cause of that, because low estrogen in somebody under 45, you know, low progesterone, we know that one is very, 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 very common in terms of like stress can impact it and like how it's something that we see so often. Yep. But with low estrogen, we always want to ask like, what is going on here? Why are we not getting enough estrogen production?
Yep, of course. I know. And even part of it, they said was like the time of the my period that I took the test. They were like, it could be true, you know, there could be things, could be not. So I'm like, I'm going to do another one.
Everybody listening, your estradiol, if we want to test that, we want to test that day 3-4 of your cycle. And we want to do that with an FSH. So we understand how the brain talks and how the ovary responds. And then the other time that we can test it is roughly 5 to 7 days after ovulation, when we also want to look at progesterone. If you test it around ovulation, you're going to look like you have the highest estrogen of anyone, and that's good.
You're supposed to. Yeah, you should around that time because you're ovulating. Okay, this is totally, I'm like taking us on a curveball real quick because we're about to jump into questions. But I was cracking up because I've seen so many TikTok videos of this, and then I saw it in your book, and I was like, oh my God, I'm going to be vulnerable and go out on a limb and say I have butthole lightning. And so does my sister. Yeah. And I'm reading your book and I'm literally like, oh my God, what the hell is that? It's just like a flash of pain.
Yeah. Heavy painful periods and butt lightning, MRI or ultrasound to look into endometriosis. That's what I'll say. Yep. If you have a history of heavy painful periods and you've experienced butt lightning, don't miss on checking if it's endometriosis, because it very well could be, and it's highly, highly missed. So the electric shock into your anus, that is something that a lot of people can experience, this, men as well, but with women, when we see it around their period, it can be related to increased prostaglandins, and that causing that shooting pain into their anus. And it can also just be how you're wired. It can be how your uterus is tilted. And so it can be these anatomical differences. But that is the biggest thing so here's where, like, take your magnesium, take your omega-3 fatty acids. Those can help with prostaglandins. And then If you also have heavy painful periods, you have pain sometimes when you poop, sometimes your bladder feels achy around ovulation or as your period is approaching, you ever have pain with sex, then we want to make sure that we're not dealing with endometriosis.
Yes, absolutely. No, I mean, but I read it and I was like, oh my God, I remember having those a few times, but it's interesting. It's like, these are things that no one has told us to pay attention to. It doesn't matter. Don't pay attention to it. We don't know what it is. We don't talk about it, whatever. It's like everything your body is doing is telling you something. So pay attention to it, because if all your little, bingo cards go, like X's are all lined up, it means something. So pay attention to it, right? Okay. Love that you answered that. That was very helpful. Butthole lightning is just kind of hilarious. So let's be real. We didn't even get to talk about cycle syncing and endocrine disruptors. And I want to get these right in advice answered. If you could give me one thing about endocrine disruptors that you have found to be the most fascinating, like lately with your like studies in it, what would you share?
So everybody hating on the trad wife trend. If you're making your own bread at home, you are avoiding one of the biggest endocrine disruptors, which are halogens that they put in bread. Yeah. Somebody actually called me a trad wife and sent me this really nasty DM. And they're like, ew, gross. Making your own bread and ice cream at home. Like, you're another one of those trad wives. And I was like, yeah.
Excuse me.
Yeah. Becoming a doctor, trad wife. But I was like, then you would love to know that I used to grow my own food and keep chickens. And like, I love DIY life. I love homesteading. It's fun.
It makes you happy. Who cares?
But I just will say that bread trend, I'm like, no, this is great. Like, and you could up the fiber in it. And there's like so much that you could be doing to make better bread. So bromine is often found in bread. Bread on the shelves has to have preservatives. Halogens include iodine. Iodine is for your thyroid, but other halogens like bromine, that can affect your thyroid and be negative for your thyroid health. So that's a big thing. And if you're somebody who ever freaks out about endocrine disruptors, like 3 things that I always tell people, really simple, you can do them today and it will start changing your hormones for the better. Number 1, never ever do you walk in your house with your shoes on. That is gross. It is icks. And if you do it on social media, I can't even pay attention to your comment or your content. I just sit there and wonder, do you wear those shoes outside? Oh my God, on TV shows when people sit on their beds with their shoes.
Oh my God.
Livid. I'm like, I can't watch
this.
Get your shoes off your bed. They're so filthy. Like you've got dog poop. You've got flame retardants. Like, you've got like antifreeze. Like there's just like all of this stuff that like can be on your shoes tracking around the house. So take off your shoes, get some house slippers. All right. Lord. I live in the tropics. If I can make it work with house slippers, friends, you can too. The second thing is if it's got fragrance in it, just like yeet that right out your window. Like no Glade scented, no Febreze, no. Yeah. And they're going to come at me, chemical companies, because you know what you're doing.
Oh, I know.
No Yankee candles. None of that. Whenever it's Yankee candle season, I'm like, oh, great. Like, here come all the patients with like new onset of migraines.
Oh my God.
Like, what's wrong with my head? I'm like, you're huffing chemicals. Like, stop that. Don't do that. Like, get a simmer pot. Like, get a simmer pot and simmer like some fresh herbs or even dried herbs, and it smells so good. Or get an essential oil diffuser. Yeah. And then you get like, I always love, I saw doctors being like, oh, these essential oils people, like lavender can be an endocrine disruptor. And so you shouldn't have essential oils with lavender. I was like, brought to you by the same people who are like, yeah, put Febreze, use the dryer sheets. Like, it doesn't matter.
Yeah,
like, no.
Literally. I'm like, no.
Don't be like, getting crazy with your essential oils. But if you want your house to smell good, use that instead.
Yeah.
Check your personal care products for fragrance as well. And I know they're expensive, but like they got to go, and they don't have to necessarily go right this minute, but you should be spending the time as they phase out. You're running out of that product to research and find something better.
Without that.
Then the third thing I'll say is open up your windows. One day out of the week, open up all the windows in your house, air out your house, because your indoor air pollution is very toxic compared to the outdoor air. And so you can do those 3 things. Yeah. I could give you way more, but you could literally do that today.
Keeping it simple.
Today, and you will change your hormones for the better.
Keeping it simple, right? And hormones is all the things we've talked about, like all of the things related to your period or like basically hormone related. Your body is made up of it. It's how it makes your body run. So these things are important. There's a tie. And that's exactly what I wanted to make the point on. So thank you for like throwing that in there. I'm like, oh my God, there's a few things I need to be better about. Not going to lie. I'll be real. Yeah. I have a few things I got to get rid of.
All of us. But you also like have to give yourself grace. Like you don't have to be perfect.
I know.
When you die, I don't know. I haven't been there yet, But I'm going to say I would almost 100% guarantee there is no blue ribbon that says you did everything perfect, winner. No. I don't think it's going to happen.
I don't think it exists.
Like, the other thing too is that people who are like, look, I love this hair product, or I love to get my nails done, or I need to get my hair dyed, things like that. Then I'm like, okay, then that's the thing you're going to be doing. So remove something else that has an impact that's a chronic burden, and know that you're doing the best you can in, with everything else. And if you're doing that, make sure that's a day that you really like pay attention. Am I drinking enough water? Am I moving my body? Am I pooping? Like, am I doing everything I need to do to run my detox system?
Yeah, to get the detox out of your body. I love that. Because you can still have the things. We're not saying go full granola mode, but like do a few things at least, right? Like make your body feel good.
That's something else I've been called is like the granola,
I know.
Them, or a crunchy mom. And I'm like, just because I live barefoot most of the time does not make me like, And I had to look up what a crunchy mom was. I was like, people come up with all these like names. And I'm like, I don't know. I just do things I like doing and based on the science that are good for me, but okay.
Yeah, but people can't see it like that because if they haven't done it, they don't understand it. They want to judge, right? It's like, okay, please with that. Okay, I have a few call SIDs we're going to get in so Jolene can go on with her day because she's got kiddos running around and all the things. So this one says, hi, Sid. Love the podcast and all you do. I have a question for you and Dr. Brighten. For the last few years, I've been dealing with an irregular cycle. Sometimes I'll spot for 1 week and then bleed for 2. Along with that, I don't get my period around the same time every month. Sometimes I'll be on my period for 2 weeks and then my period a week after that. My periods are very heavy and painful to the point where pain keeps me up at night and I can't move. My doctors prescribed me medicine for the pain, which had helped, but it's still really bad sometimes. I've talked to my doctor and we switched my birth control 3 times in the last 2 years. At one point, I had a copper IUD and was taking the pill. Now I have the Skyla IUD, but I'm still experiencing the same irregular cycles. Should I consider getting off birth control? I've been on it since I was 17 and now almost 24. I've heard that it might reset my hormones or something like that. Any advice?
Oh, okay.
I know.
I gotta say, about it. Like in the beginning, I was like, this is giving perimenopause.
Yeah,
like this is giving very perimenopause symptoms. But my question would be like with all this spotting and everything that's going on, like if that's been going on. So that can be common when you have the IUD to have like spotting and really weird periods and they get irregular and that's because in some people that progestin, while it's working on, cervical mucus, is doing all of these things to prevent pregnancy, that progestin, for whatever reason, it can shut down ovulation in some people and not others. And so that could be what is going on. And that is not uncommon to have weird periods like that when you have an IUD. And if they're annoying, then definitely considering getting out. It's so painful and I got pain meds and they're not working anymore. Endometriosis, adenomyosis, those are the 2 things that come to mind. And unless you're working with a doctor who has expertise in it, they're not going to catch it. And it used to be that laparoscopy it is still the gold standard, but it used to be that's all like people would do. And they'd say you have, like, anyone who's like been following me long enough, you listen to a podcast of me like 2 years ago, you would hear me say, like, that's how we diagnose it. That's unfortunate. MRI and even ultrasound, it's come a long way, and it now can be diagnosed that way. I recently, just in the last year, was diagnosed with endometriosis and adenomyosis, incidentally on an MRI. Pronuvo was like, hey, we'll give you an MRI. And I was like, yes. And everybody's like, you shouldn't do these frivolous things. Everybody with medical credentials is like, that's frivolous and people shouldn't do that. The average person, I'm like, I'm curious. I want data. I want to see inside my body. Yeah. Also, like, it's the best nap I think I've ever had in my life in that MRI machine. And it came back and they're like, oh, adenomyosis, endometriosis. And I was like, that what? What? No. And
that's wild.
Dang. So I'm so glad that I got that done and found that. And that is something that I encourage people. If you are having periods like that, you can't, if you have a copper IUD, so people know you're not going to be able to go in an MRI machine. Yeah. You can't have any metal in your body. But if you have those kinds of periods going on, the IUD is obviously not working for you. Yeah. The pain meds are not working for you. It's time to get with somebody who can really work you up and understand, because your doctor tried, those treatments didn't work. It's time for something more. Yeah,
I'm going to let you speak to that one, because that is a lot of symptoms that I don't know how to work with. And I would just say, do something about it. Whatever you do, do not wait. Do not wait.
Yeah.
This next one says, hi, Sid. First of all, I wanted to say I love your podcast and the direction you've been taking it. I look forward to the new podcast every week. Oh, that was nice. My questions for Dr. Jolene is, what suggestions does she have for someone struggling with, they lost their period due to hypothal. Oh my God, I've never seen.
Amenorrhea.
Yeah, you knew exactly what it was. I was like, what is this word? Okay, while they were under extreme stress due to grad school and other life events. I was diagnosed with it last year and never got it back. And so I went back onto birth control for the time being. I am currently in graduate school and no stress can contribute to my period loss, but the pressure of school is a lot and I don't know how to work on recovering my period while in school. Any advice is greatly appreciated.
You cannot recover your period as long as you're on the pill. And the Endocrine Society says that if you have someone with functional hypothalamic amenorrhea, you should not put them on the pill just for the period. If it's birth control prevention, that's different, but just to try to treat their period, because you'll never know if they actually reclaimed it and regained it with the interventions that you need to employ. So if you know grad school is stressful, I've been there, I know this. God, sometimes drinking like coffee at like 8 o'clock at night. Like, who was I?
Yeah, literally.
Not good.
What is going on?
Yeah, if you know it's stressful, you need to find other ways to signal to your body that the environment is safe. Eating regularly, getting enough calories, making sure that your exercise isn't like, you know, what people say, balls to the wall, like, you know, go hard. No. If your period's missing, that's not what we're doing. We want to keep it gentle. You can strength train gently.
Yes.
You can do yoga. You can do other things. You have to have mind-body practices. This is where, like, I wear an OURA ring, and I love the OURA ring because it tells you about your resiliency and your stress. And you can track that, and you can keep tabs. I actually did a podcast with a male host, and he was talking about how this guy who says that women who stay home, they have better estrogen, but if they are working moms because of stress, they have higher testosterone. I'm like, let me see the data on that, because I don't think that's necessarily true. And I know from my OURA ring that I can go to work and I am fine. I am home with my kids. I am stressed.
You're like, help me.
I am stressed. I got 2 boys. One,
they're boys.
Like, is a toddler. My God, it's suicide watch. Like, every day, I'm like, can you stop trying to die?
You're like, why are you walking over there? Don't go.
Get me a break. So I just want to say that, like, you know, while this person's at grad school, there's a lot of different ways that we can all feel stress. So tracking your stress and knowing, I felt so validated when I saw that with my OURA ring. I was like, this is how I feel, and this is real. Okay. And so really trying to understand, like, the events and what are the things that help you decompress. You have to take space to decompress. You have to have practices that help you stress less. I also always consider, like, adaptogenic herbs in this kind of situation, like rhodiola, holy basil, ashwagandha, these ones. So where I love rhodiola, well, rhodiola is a great endurance herb. When someone has to have mental and physical endurance, that herb wins. Ashwagandha is really good at putting the hush on cortisol. Holy basil is like, keep it chill, guys. Like it's all good. That's crunchy, okay? Holy basil, that.
Hey, if it's crunchy, it works, and I'm all for the crunch. Listen.
Yeah. The other thing is sleep. We got to get that sleep in check. You know, research on sleep has mostly been done on men, and it's like, oh, you need like 6 to 8 hours. As women, we need more. And in your luteal phase, that's where you need to give yourself permission to sleep more. So once you do get your period back, make sure that you try to get an extra hour of sleep during that luteal phase. So look at the calories, look at the nutrients, look at your other areas of stress, and then look at how you can mitigate the stress. Grad school is a short period of time. You're going to get through that. But how are you going to take care of yourself in the meantime is the question. When I was, studying for my master's in nutrition, I was going to go a PhD route. I will tell you, one of the things that turned me off from being a PhD student is I could actually see when these PhD women came and talked about nutrition research and everything. And I could see, based on their hair growth, like I could see what had changed in them. In the time they'd entered the grad school, seeing the stress. And I'm not talking about gray hairs. I'm talking about the hormonal changes that can lead to kinkier hair, to frizzier hair. And I remember sitting in the room. And listen, I'm not sitting there judging how you look.
No,
I'm sitting there being like, nutritionally, stress wise, like, is this the route I want to go?
That's alarming.
These people look tired. And so, that's the biggest thing I can say is like, if you do not take the moment now to start prioritizing your health and giving yourself permission to pause and to work on your stress, like when you lose your period, you are under extreme stress. If you do not start working on that now, you're going to set habits and patterns that are going to affect you in the future. And it is so just important to understand that the inputs that leave us this stress, I think a lot about athletes. And whenever people ask me, what do you think about athletes whose coaches are like, just go on the pill now so that you can be better? I'm like, I think they're going to abuse an athlete because your period is a sign of your health. And if they overtrain you and underfeed you, you'll lose your period. But if you stay on the pill, you'll never know it. And they get away with abusing your body.
Oh my God.
So please, everybody, know that if you miss and you lose out on those hormones that you are supposed to be making in those years, your 60-year-old self is going to feel that.
Yeah.
And do not look back with regret. Like today is the best day to start making changes. Maybe it was yesterday, but you didn't have that information then. So today is the absolute best day to start improving your health.
Your health matters now, later, anytime. Now, in the past, what you've done, but you can only start from right now. So do something. I always say this too is, why are we caring so deeply about taking time externally, making ourselves look beautiful, learning new hairdos, learning new makeup routines, and we are not doing the same love for our insides. And without our insides working properly, say sayonara to the outsides, because that just it's not how life works.
True.
So I'm like, it just baffles my mind. But then even I'm somebody right now where my goal, because I've figured out a lot of health stuff that I'm like, fix, check, things in balance, stress. So that's my next little, my routine and work. Okay. Last and final call, Sid. We're going to do it. All right. It says the theme is 2 years post-birth control. I am going on 2 years post-birth control, and I was on the pill ages 15 to 19, then switched to Nexplanon. Did I say that right? Bar in your arm. From ages 19 to 22 in 2022. Upon getting my Nexplanon removed, I struggled with regaining my period, very inconsistent periods. In June of 2023, I began getting what I thought was my period every other week. I spent tons of money on getting lab work done, seeking gynecologists, only for them to tell me the best thing is to go back on birth control to regulate my cycle. I feel so defeated and invaded. After allowing my body to just continue doing its thing, I finally found regularity in my period in October 2023, so last October. And with tracking my ovulation with strips and the OURA ring, I think I ovulated for the first time in December 2023. Lots of background info for this. I know, I'm like, yay. I feel like everyone's bodies are so different, and after feeling so out of touch with my body and cycle, I would like some advice for navigating the times post-birth control and reach regularity normality. What is an ideal menstrual cycle supposed to be like? How will I know if my body is completely regulated? It still feels off and still like a spot a little bit. I have mid-cycle bleeding. Like, what does that mean? Lots of questions, I know, but it's been an ongoing journey post-birth control for 2 years, and I'm struggling with feeling so disconnected with my body. I've listened to Dr. Brighten's audiobook, and I love Well Said. Thanks so much for all you do. Cute.
Is this normal can absolutely help with answering the whole
I was
question
gonna
of
say,
like, what's a normal menstrual cycle? What is actually normal? Normal is a range. I want everybody to know. It's not just like, 28 days. Like, there's a range of each component of your menstrual cycle that we should understand. The mid-cycle spotting and everything that's happening, it sounds a lot like, and I don't know this person, and I'd have like a billion questions to ask.
I know.
She's not here. But it sounds a lot like, the hypothalamus, pituitary, ovarian axis is struggling in terms of its communication, and even possibly that we are having irregular ovulation, or there's a corpus luteum issue. So having a luteal phase defect. So, because sometimes when people say mid-cycle spotting, they mean like, hey, like, I'm going along, and then after ovulation, then I'm like spotting, and then I end up having a period, and that's because the progesterone levels can't get to where they need to be.
Oh, I see.
And so looking at that piece, I feel very frustrated for her, because she's like, I've been to all of these gynecologists. I had a patient recently who was like, I've been to 7 doctors and blah, blah, blah. And then I was like, start explaining stuff. And she's like, why have I never heard this? I'm like, I'm wondering, why those 7 doctors never said this to you, because this is like just standard, but she was just offered the pill for similar situation. And so we want to look at supporting mitochondrial health is what I'll say. And in this case is one of the steps that we want to take, because the ovaries are really rich in mitochondria.
Yeah.
This is where like using things like red light therapy, making sure that we're avoiding environmental toxins, that we are, if there's any medication use that like can impact the mitochondria, we take a look at that. Is that necessary? Is there a different way to go about it? We're bringing in antioxidants, so bringing in nutrients that are going to support and protect the mitochondria. The other thing I also would have a question about like what's happening with cortisol and what's happening with melatonin,
right?
And understanding how, what's your circadian rhythm, what are your hormonal cycle around that as well. And taking a look at that piece. I mean, that's also another good thing for the grad student to think about as
for
well.
real.
As like what's happening with circadian hormones. But also looking at I would be very curious in doing testing. So like looking at nutrient status, things like vitamin D.
Yeah.
People can have irregular cycles if they don't have optimal vitamin D. And I'm not talking about 20 nanograms. I'm talking about like actually getting that around 50. And the other thing is that I would be curious to look at her labs and to understand where are all of her hormones at. Because the other thing this could be is that if you're going to gynecologist, they may have missed checking your thyroid. This very well could be a hypothyroidism picture. It just depends on like what else is going on. But if you don't have enough thyroid hormone, you can't mature an egg. You can't ovulate an immature egg and expect to have a corpus luteum. And so it's going to affect your menstrual cycle. And so this is definitely a situation where I'm like, I would really want to see that thyroid panel. I'd want to see other hormones as well, but I really would want to see that thyroid panel.
Note to everybody who wrote in, like, just look into what is going on. Like, go to the right people. If that means going to Jolene, I don't know. Obviously, if you're taking new clients clients. Yeah, I guess clients, you can call it that, right?
They're patients.
Patients, clients. I know. I'm like that word. I didn't like that word, but I'm going to use it. But either way, do something about it. Do something about your health. Pay attention. Listen to your body. Even you writing in is an act of like curiosity to go towards the next good step forward. So keep doing those things. Okay. And also get her books, because Is This Normal was like the most eye-opening for me, I would say. I mean, Beyond the Pill was beyond helpful, because it got me over that hump of like, what do I need to do to get off the pill? Like, what am I doing? What's the other side look like? All those things. But I love both of them. Coming from a non-reader, that says a lot. I
don't think that you're a non-reader. I think you need to reframe that.
Slow down.
I always thought I was a non-reader, but then I realized that I just hated every single book I was ever assigned to read when I was growing up. And I'm like, I'm not a non-reader, because like if I'm interested, I will read it. But I did not want to read. I think about Anna Green Gables. I never read it. I'll never read it.
No, I don't even know what that is. I'm like,
someone's gonna be like, I love Anna Green Gables. I'll be like, I was not interested.
I need to be. It has to be the right book then, and I also need to like be sitting and being like actively like, okay, I'm going to sit. I know I'm going to sit, because my ADHD will be like, wee, like, what am I doing over there? What's going on over there? If I'm bored of the topic.
Well, that's probably why you got through my books well then, because I have ADHD and I write them with that in mind.
Yeah.
Of like, look, people don't have the attention. Well, I thought before I was diagnosed, nobody has the attention span to sit here and read a book front to back. Like,
that's what I thought.
That's so boring. Like, naked so they can get in and get out and get their questions answered. And then I found out that like, no, indeed, people do that, but not me. I'm not that person.
Me too.
And so I write the books so that you can read them front to back and they flow, but that also you can just get the answers you need. Yes. And I also just, from my perspective, when you don't feel well, you want to read the whole story. You just like, I mean, I started this whole podcast with vagina story, and those people are probably like, why did you do that? Like, just get to the point. And my books get to the point. You can skip my stories.
No, your stories are the best part. I think they are. And I'm like, I'm so I'm so bummed we didn't get to like cycle syncing and all the things, but I'm just going to call you back and I'll just have you back. That's no big deal.
We'll make it happen again.
We'll talk about postpartum. We'll talk about cycle syncing. We'll talk about all the things that we miss because there's just so much to cover. But that's also the beautiful.
Like we talked a lot.
I know we did. I know. And I'm like, oh shoot. But you know what? The beautiful part is that's all about the female body, and it's like slay. We're discovering. We're talking about it. We're learning more. So that's all I have to say about that. Thank you, Jolene. This was so much fun. You're always so much fun. You're so fun to learn from. You're also just like a light that I look at for like more information about females because it's hard being a female sometimes and not knowing your own body and not knowing, and female doctors not knowing your own body. And you're like, huh? How does this work?
Yeah, so, you're like, we got the same parts. I don't understand.
You don't know, huh? So if you want to find Jolene, actually, why don't you tell them where you'd like them to find you in the most easy spots or your favorite spots?
drbrighten.com, DRBRIGHTEN. So Brighten like the sun. You can find me there. You can find my supplements at Dr. Brighten Essentials. And then you can find me all over social media at Jolene Brighten.
I need to try your supplements. I haven't tried your supplements yet. I need to get on that.
Oh, well, let me know. I'll send you some.
Oh, I'll tell Angela right after this. I'm going to be like, Angela. Crew, thank you again for being here. You're amazing. And just all the work that you've done to like open people's eyes to health and hormone health and periods. And oh my gosh, it's changed my life. And I know that it's changed a ton of other listeners' lives and people way vast past my circle of people. So appreciate you. Well said, crew. Remember, if you're ever like, what the heck? How did these people get their write-ins in there? You can always call me. It's 612-470-7569. I prefer you leave a voicemail. It rings for a little bit. It'll get to it, I promise. Or you can write in if you're in Canada or abroad, anywhere outside of the US. You can do my Get Advice on my Instagram in the link in bio, or it's in TikTok too. So wherever you want to go. And always, please, if you could go subscribe to YouTube, it helps me out. It helps the business keep growing. So, I appreciate you being here. Jolene, it was lovely. Everybody, we'll talk to you soon. Bye.